So let's have a look at communication in the veterinary practice. Communication, who will you communicate with in the vet practice? And then of course, how does your communication affect the flow of the clinic? So in the vet clinic, we communicate with everybody and everything. So we might be communicating with other vet assistants, with veterinarians, with registered vet techs, with our patients. So the dogs and cats, we're always communicating with them through body language and direct communication. And then of course with clients as well. And how does your communication affect the flow of the clinic? Well, we've talked about communication a lot so far, and we know that poor communication completely ruins the flow of a clinic, and good communication can help facilitate an efficient and effective flow of the clinic. So looking at flow and communication, we know that good communication creates an efficient workplace, and teamwork toward a common goal has been identified as a key characteristic in successful clinics. That has been a database study that found that information. Communication within the team, including the boss, is very much necessary in the clinic. And communication with animals can't be overlooked as well. As you guys work your way through various Sorry, my dog is going nutty. As you guys work your way through various animal handling courses, you'll soon realize how much your role in communicating with the animals can have an effect on the way they react to you. The way we communicate with clients can change the level of care that they provide to their pet, which is wild. The way we communicate with clients can actually impact whether or not a client will undergo a treatment for their pet. So excuse me, veterinarians and communication. Client communication overall is a fairly new topic for veterinarians. It's something that has certainly been overlooked in the past in regard to its importance when vets are in vet school. Studies have shown that pets will not get treatment they need because the veterinarian makes assumptions about the client and does not present all options to the owners. So when a veterinarian makes an assumption about the client, then because of that assumption, they tend not to present all of the treatment options that are available. Some of the assumptions that veterinarians and technicians and assistants might make about their clients, they might think the client has no money, they might think this client has already spent so much, and this client's already mad at us, so I can't ask for more money. What's the issue with making assumptions like that? Well, the issue, of course, is that pets can suffer because the ideal treatment, the risks, and the benefits were not properly communicated to the client. Why might vets have a difficult time going through an estimate for treatment with a client? Well, mainly they make assumptions about the client's beliefs. They assume it's too much money to ask for, so they're feeling guilty that it's too much money to ask for. And they assume the client will speak poorly of them or of the clinic because of the amount of money they had to spend. So the big issues here is that the veterinarian and the vet team are making assumptions. And when we make assumptions, we might be assuming something that's incorrect about the client. So assumptions overall don't allow us to see the client in full. Instead of making assumptions, studies have indicated that both veterinary staff and clients get greater satisfaction from interpersonal aspects of care. When each party feels respected and involved, a sense of trust is developed. So let's have a look at this one on the level of client communication for veterinary assistants. Before our extended break, we talked a little bit about the 4 habits approach. And you guys have a worksheet that has a whole bunch of different examples of using the 4 habits approach in vet medicine. So this was an approach derived from human medicine, and it identifies which actions should be in place to make the client feel most comfortable, respected, and valued. One reason to follow the 4 habits approach is to improve the success of the vet hospital. Another reason to follow is it avoids conflict in the vet hospital, so it helps to reduce the chances of client conflict. So the 4 habits, The principles are invest in the beginning, elicit the client's perspective, demonstrate empathy, and invest in the end. And for you guys, testing wise and going forward, it would be good to definitely understand each of these 4 habits and be able to provide your own response of what would an example sort of statement or an example action be that would fit within each of the 4 habits. So invest in the beginning. We only get one chance to make a first impression. In this aspect, the client has just entered the clinic. We want to greet them. We want to create rapport. So that means that we want to create a relationship. We want to talk to them, let them know that we are acknowledging their existence. We're going to acknowledge long wait times in the clinic. Ask some open-ended questions. So how's Fluffy doing? Tell me about Fluffy. What's going on with Fluffy? How's your day today? Let the client know what to expect. So I'm going to get Fluffy into the computer, and then the RVT is going to triage Fluffy. And then once the doctor's ready, they'll call you in. And then as well, repeat the client's concerns back to them. That's active listening, and it helps to demonstrate to the clients that you are listening and you're involved and you're empathetic in their case. This is the baseline approach to creating rapport, which is the start of a relationship, trust, and a feeling of respect with that client. Number 2, elicit the client's perspective. Get the client's understanding of what is going on with Fluffy. What do you think is going on, Mrs. Smith? What worries you most about this? When it's affecting the daily life shared by the client and their pet, ask further questions. Oh, she's limping? Well, what does that mean? Is she able to go for walks? Oh, she can't go for walks anymore. Okay, that's good to know. So asking them a little bit more about how they're feeling about how this injury is impacting Fluffy. This approach respects diversity of thinking, it helps to reveal diagnostic clues, and it also unveils some treatments that have already been provided at home. So a few of these helps to reveal diagnostic clues. So we know that registered vet techs and vet assistants are not diagnosing problems on an animal. However, if we know that the client, comes in saying that Fluffy is limping, okay, well, that's good to know. However, if you start to get a little bit more of a backstory about Fluffy, you might find out that Fluffy is also not eating and hasn't been eating for the past few days. Or you might find out that Fluffy started limping the day after she fell off the porch. So those are diagnostic clues. It also can unveil some of the treatments that are provided at home. This is really important because clients don't always tell us what they've already done at home. So it's good to ask, have you given Fluffy any medications, or have you given her anything for the pain at home? And this is where we might find out that Fluffy's already had Medicam at home and she's still limping, or maybe the owner gave Fluffy an ibuprofen, which is really toxic to Fluffy. So things like that can help with the overall diagnostic picture. Step 3, demonstrate empathy. And we know that empathy is putting yourself in the owner's shoes. So trying to understand what they're feeling and trying to sort of feel what they're feeling. So what does that mean again? Right? We talked about it. Putting yourself in their shoes, getting a feel for what they're feeling. So when you're speaking with the client, ensure that you make at least one empathetic statement. Be self-aware of your actions. So remember to think about how you're coming across to the owner, how you're reacting to the owner, how that might be perceived. And ensure your body language conveys empathy to the patient. So don't sit there with crossed arms, make eye contact, be genuine with your actions. This step adds meaning to the visit for the client. It builds trust and it can result in better treatment outcomes for that pet. If the client feels that you understand or that you genuinely care about the health of their pet, they're more likely to undergo treatment for their pet that's recommended by the vet. And the last step, invest in the end. This involves the client in making decisions. It provides education to the client. It tests the client's understanding of the treatment or plan. This is where you would explain the rationale for tests and treatments, review possible side effects and expectations after treatment, and ask if they have any questions. So this is where you might say, okay, I see that Fluffy's getting some medication to go home with. You would go through how to give the medication, and then nonchalantly, I would ask the client to repeat that back to you. Okay, miss, can you just confirm? Let me know, what you think about the treatment plan. Can you confirm how often you're giving the pills? Good stuff. Also, really good question to ask at this point. Have you ever pilled Fluffy before? And if the client says no, would you like me to give Fluffy the first pill and show you how I would pill Fluffy? Okay, you're helping them and you're investing in the actual treatment itself. Likewise, you're going to review possible side effects or expectations. Okay, it looks like Fluffy's going home with Medicam. That's an anti-inflammatory drug. You should start to see some improvement within 24 hours. If they start vomiting, if Fluffy gets any diarrhea, or if the limping gets worse, please call us. Really important. We want to touch base with you. This increases the client compliance. So that means that they're more likely to actually do the treatments as recommended. And it promotes a feeling of collaboration in the plans for their pet. So it makes them feel that they're actually part of the treatment plan. So the end goal, we want that client to feel comfortable with us as care providers. When there's trust and mutual respect, the patient's care increases from both sides of the desk. So we end up providing better treatment for the patient, and also the owners end up providing better treatment or better care for their pet as well. So if we were in class, we would get into groups of 3 and do an in-class activity, but we're going to switch that into a discussion board posting for you guys to complete. So carrying on through, when communication breaks down, we can positively impact the treatment and care of a pet through implementing communication strategies in the clinic. And we also need a toolbox for negative communication as well. So when negative communication happens, we need to be able to know how to handle it. So looking at some conflict resolution, very, very important. Types of conflict that might arise: team-based conflict, so within your clinic, your team, or client-to-client based conflict, either client-to-client or client-to-team-based conflict. And strategies are needed to combat both types, as each will impact an employee's sense of satisfaction with their job. Studies find that veterinary staff will miss work due to conflict, they'll have increased challenges with their own mental health, and potentially experience burnout or compassion fatigue. All of this leads to increased chances of leaving that practice. And I am certain that many of you have been in positions where you have conflict at work, whether it's with regular clients who create conflict or if it's with your boss or your coworkers. And I guarantee you it's not a pleasant experience. So we have a couple different scenarios and we will go through these. Let me just have a look. We'll go through them. So scenario number 1, we're going to look at these scenarios and then we're going to talk about various strategies for managing conflict. So some tools in your toolbox that can help you manage conflict. Scenario number 1, Mrs. Smith or Ms. Smith arrives at the hospital to pick up Buster after he spent the day to be neutered, vaccinated, and get a nail trim. Ms. Smith is extremely upset because Buster's nails have not been trimmed despite her request and the fact that she prepaid for it to be done. The issue is that Buster will not accept a nail trim without heavy sedation. Scenario number 2, RVT Samantha anesthetizes a patient and preps him for surgery. She takes the pre-op radiographs, then moves her patient directly into surgery, leaving the x-ray room a total mess. Fur everywhere, catheter remnants, lubrication, you name it, it's on the x-ray table. The vet assistant walks in with her nail trim patient, only to find the room is unusable. The practice owner has already told the staff that they need to clean up after themselves in the clinic. So there are some methods for dealing with conflict. We have compromise, accommodation, collaboration, avoidance, and competition. Compromise. One party gives something up, assuming they will meet in the middle. However, there's no guarantee for meeting in the middle. So if we look at a compromise applied to these two scenarios, scenario 1, Ms. Smith has noticed that the nail trim has not been done and the doctor on staff has already been alerted. Buster needs sedation. In order to try and make the client happy, the doctor compromises by offering to sedate Buster and to split the cost with the client. Scenario 2. The vet tech is made aware of the mess she's left behind. At this time, she tries to compromise. Sorry about the mess. I can clean it up after I'm done in surgery. It's a step in the right direction, but clearly a neat x-ray room is needed right away. So you can see that through compromise, sometimes that works out for one party, sometimes it doesn't. So there's no guarantee that's meeting in the middle. If we look at scenario number 1, Buster still had to get sedated. So he's been anesthetized in the morning, and then now in the afternoon, he has to get sedated again. So not necessarily ideal. Accommodation. When a person is more concerned with helping others and ignoring their own needs, they will take on extra work to ensure others don't feel negative consequences. And I'm sure right off the hop, some of you realize that you are an accommodator and you readily accommodate other people's needs. Scenario 1, Ms. Smith has noticed that the nail trim has not been done. The doctor's been alerted. This time, the doctor offers to sedate Buster and perform the nail trim at no charge. In addition, he asks the receptionist to give the client a voucher for a large bag of premium dog food. This should make the client happy, but it's pretty costly if we look at it in a business sense. Scenario number 2, this time the messy technician says, "I'm sorry, I'll clean it up right now." I'm so sorry, oh my gosh, I'm just going to clean that up right now. So if we look at the good and the bad, scenario number 1, that client is going to be super happy, but we have an additional cost to the clinic, and Buster still has to get sedated twice in the same day. Scenario number 2, the technician has gone back to clean it up, but what's happening to her patient that she has? So she has an animal that's under anesthetic that she's bringing into surgery. She's just going to leave that patient and go back and clean up that table? That's not ideal. Collaboration. Both parties are very interested in working together to reach a solution. Scenario 1, the doctor apologizes. He leads the client into the exam room. He offers weekly appointments at no charge to go through fear-free handling and low-stress nail trim techniques so that Buster no longer requires sedation, and it eventually could be done at home. This is a win-win for all parties involved, including the patient. The only downside is that now the doctor has invested more of their time without a cost to the client. So there is a slight loss for the doctor, but potentially this is a really good long-term solution. Scenario number 2, this time the vet tech's response is, "I have an idea. Can you please put your patient back in a cage for a moment and monitor my anesthesia patient? I'll clean up the x-ray room, then we'll switch back." So there's a potential option if the vet assistant is able to support the anesthesia. If not, then perhaps simply an apology might be acceptable. Then we have avoidance. The person who has made aware of the conflict acts as though it doesn't exist. They do not want to acknowledge that this is an issue. Scenario 1, the tech alerts the doctor on staff about the missed nail trim. The doctor's response is, "That procedure can't be done while Buster's awake. He's not even my patient. Plus, my schedule's full for tonight, so someone will have to deal with it tomorrow." So that vet who's on staff does not want to deal with that problem at all. They're avoiding it. Scenario 2, the tech who found the mess makes the assistant technically who found the mess makes the previous tech aware of the inconvenience. The tech who created this situation says she was too busy to clean it up. Now she's in surgery, so there's nothing she can do. Essentially, she's saying, "I don't care," and deal with it. So she's avoiding the issue. And then lastly, we have competition, which is not a great way to handle things. Very little concern for the other party involved. The approach is, "I win and you lose." So if we look at the scenarios through that lens of competition, She's noticed that the nail trim has been done or has not been done. This time the doctor's response is, that patient's nails can't be clipped while he's awake and my schedule is full. Tell her that if she had trained her dog properly, this wouldn't be a problem. Now we'll have to do it the next time we sedate him for something. So that doctor is like rubbing it in the owner's face that this dog has a behavioral issue and it's not the doctor's problem. Scenario 2, whoever left the room a mess was alerted, and the response is, well, I'm busy. Someone who isn't doing anything could clean it up. If everyone knew how to monitor anesthesia, I could have cleaned it up, but it's not my problem anymore. I'm stuck in the operating room with the doctor. So really, it's a snarky response, and I've seen this in clinics before. I've seen receptionists act like this to clients. It does not get you very far. Not ideal. So, which of those conflict resolutions would yield the best results and why? And should we always stick to just one style? So essentially, collaboration is the most ideal, or could result in the most ideal long-term results. So collaboration can be really great. However, certain scenarios will call for certain types of conflict resolution. So when we ask, should we always stick to just one style? The answer definitely is no. If you think of something like you are meeting with your boss for your annual review and you're looking at getting a raise and you need to sell yourself as to why you need to get a raise, then collaboration and accommodation are not going to work very well for you necessarily. So collaboration, if that's not working, if your boss is not willing to work with you to come to a good conclusion, you might have to insert a little bit of competition and say, well, you know what? If we look back on my performance over the year, I was able to yield this many sales in heartworm meds and blah, 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 and sort of increase that level of competitiveness to get what you want. So looking at the different conflict resolution styles, generally there might be a time for each of them. Some of them in general are better than others. Competition is rarely a good idea, especially when working with clients. Likewise, accommodation seems like it might be nice at first, but you're the one that's always giving something up. Not ideal in the long term. So sit and think about different options of when you might use each of those scenarios. In general, collaboration can be really great. So again, going back to some of the other approaches, negotiating a raise, requesting a refund for poorly functioning equipment, dealing with an abnormally aggressive client, then collaboration might not work, and you may have to unfortunately just shut that down and follow up with the client when they're less emotionally charged. Remember that the goal is mutual respect and feeling that both parties have contributed to the results. Okay, so that's it for conflict resolution. And then just talking about what we have yet to do. So your time management portfolio, I have new guidelines on how to submit it. It will be through Turnitin. And essentially at this point, it should be pretty much completed. So I'm going to post the Turnitin link today, ideally. And if you want to get that done and handed in, you are absolutely welcome to get that off your plate. Don't make more work in the end. Please don't leave it to the last minute. You will certainly get docked marks if it's late, and I just don't want you to go down that path. And then, as always, connect with me now if you have any questions about the content or if you'd like to review. Please review discussion boards, journals, and turn it in for comments from me as well going forward. But that's about it. And I will see you for the live session. Bye-bye.